So today we're going to talk about end-of-life care with your pet and what to expect. So some of the common questions we get are, how do you know when it's time, what to expect, and the aftercare. There are going to be some other questions you might have, and we're here for you, especially if we've built that relationship with you throughout the years, or even short term in the last year or so. We can help answer some of these questions and guide you through this process. So first off, we have, how do you know it's time? That's a pretty difficult question, and most of the time I do tell people, you're going to know better than I'm going to know. They're going to have some unmanaged pain potentially. They might be crying out, or they might refuse to eat and drink. Some other things I like to say are when they're not being that animal that they used to be. So they're not being a dog anymore, or they're not being a cat anymore. If they can't get up on their own to go potty, or say they're having more bad days than good days, I think you know it's time. Another common question that we're going to cover now is what to expect at the end of the life appointment. So some of the things I always want to generate for you is kind of peace. This is a kind of difficult process to go through, so I want it to be as peaceful as possible. For some of our clients, we do offer at-home care, but we do need to make sure that that is right for your family. We typically do them in the office here. We don't like to go out to the vehicle if we don't have to, but what we're going to do is sedate the pet first. We're going to sedate them so that that's the only maybe poke that they feel, if they do feel it at that point. Most animals are kind of ready for the passing, and this is just going to kind of help them along. They're going to be still aware of you. They're going to be able to hear your voice. You can hold them the whole time. I want them to stay with you ideally. If you are unable to be with them, you can designate one of us as your care team members to go with them through that process. I'm happy to do that for you. When they're sedated, once they're good and sleepy, doctor's gonna come in and they're gonna give them a little, basically it's a little catheter kind of in a vein. And sometimes on cats we'll do it a little bit different because of their size. But again, they're sedated. They're not gonna feel any of this. They're still gonna be able to hear your voice depending on the level of sedation. And at that point, it is time to say goodbye. So you just tell the doctor when you're ready, or your technician who's with you, and then they're gonna pass. Sometimes they go through some phases of basically anesthesia is what's happening. It's just a high dose of anesthesia. And so we can talk to you about that. You may see some muscle twitching. They may take some deep breaths, but those things are okay, and those are to be expected. And lastly, I want you to be aware too about aftercare. You have some options. So we're gonna generally get you a paw print, maybe a little lock of hair if you want some. And at that point, you can either take them home and do a home burial for them, or you can have them cremated and get the ashes returned, or the ashes unreturned, where they just basically get buried in a cemetery. I know this process can be difficult, but no, we are here for you, and we can answer any of your questions that you might have.